Long COVID is still something of a black box for experts. So what can we do to fight back? Are vaccines still our best solution? Dr. Owais Durrani is back with us again tonight, emergency medicine physician based in Houston, Texas, and he's also the author of the brand new children's book, Basketball, Science, and Rockets. Dr. Durrani, when it comes to long COVID, recent studies have shown almost 80% of related deaths are in white patients with long COVID. The major discernible risk factors are pre-existing anxiety and pre-existing depression. Are we getting clarity? Is this more physical, mental? What is it?
Yeah, thanks for having me. We have a lot more work to do when it comes to, figuring out what long COVID is and what causes it. You kind of had two parts to your question, mental health issues. Honestly, for the last, up until 2 decades ago or so, as a society, we kind of ignored mental health. And even in the medical profession, we didn't pay as much attention to it as we should have. Over the last decade or so, we've learned that mental health conditions put you at a higher risk for things like high blood pressure, diabetes, coronary artery disease. Now we're learning, as more and more papers come out with regards to COVID, that it leads to inflammation in the blood vessel. That leads to a lot of the same things: diabetes, high blood pressure, kidney disease, heart disease. And so you imagine folks that may have had COVID have higher risk for getting some of these things because they've had some mental health conditions, and that's a big overlapping kind of area where it puts them at a higher risk for getting these long-term side effects and whatnot. What's the reason for them? We have a lot of work to do to kind of figure those reasons out and then find solutions for them.
Still very complicated. Okay, understood. Today, an FDA advisory panel endorsed a plan to make all COVID shots bivalent, which is 2 subvariants plus the original strain, I believe. They did not recommend, as anticipated, making this an annual shot at this point. Was that the right call?
I think so. Take flu, for example. We have an annual shot for that. We have 100+ years of seasonality data that tells us when flu season is, when we should get those shots, and how much protection we get from them. We're still only a few years into COVID. So yes, we know that during the winter months, there's higher transmissibility, higher transmission, but we've had summer surges, spring surges, winter surges. And so I don't think we've truly established that seasonality, and we truly can't say that, hey, if you get your shot in October, you're going to be good, really good for these first 6 months, maybe not so good for the next 3 months. So I'm glad they didn't make that a definitive kind of recommendation. We also still have lots of groups where, you and I may be healthy kind of middle-aged folks, but we've got kids and elderly, and then various groups within the elderly that are very immunocompromised. And we need kind of clearer guidances for those individuals as well before we make kind of broad 1 or 2 size fits all kind of recommendations. So I'm glad we kind of left the door open on that. We still are in the early phases of this pandemic, even though it feels like we've been in it for 10+ years. It's still the early phases. And so I'm glad they left the door open on that.
10 is a minimum that it feels like, but yes. I actually wanted to ask you about those other populations because I think most of us by the numbers have gotten boosted, myself included, but honestly, I didn't get another one this winter. I thought, I don't know, do I want to get sick from getting it, all this stuff. And we have seen reports of boys and young men having heart issues occurring at a greater frequency than like COVID deaths in that population. Recently, the CDC said the new Pfizer bivalent vaccine might be related to stroke in people 65 and up. The FDA disagreed, I believe. Who should absolutely not skip a booster, and who should maybe ask their doctor?
Yeah, I think if you have any questions at all, ask your doctor. And if your doctor doesn't know the answer, say, hey, can you refer me to someone who may know these answers? And it's always okay and good to ask questions. I think if you are, anywhere over the age of 50, you should more than likely be getting the shot. And if you have any questions, ask your doctor. And kind of some of those 2 studies that you mentioned, I just want, a caveat to those. It's good that we're looking into this. It's good that we're getting data with regards to these things. But there's always a background rate of disease in society, right? So some folks will get myocarditis or strokes even if they never got COVID or never got the COVID vaccine. And so we really have to lay out the data clearly and show, what percentage increase was there when they got the COVID shot? And then what if they hadn't gotten the shot and they got COVID, which is still very prevalent in our society? A lot of things like, for example, myocarditis, you have a higher risk of getting it when you get COVID. And so we need to kind of, when we present this data, and when I do it, when you do it, when anyone else does it, kind of make sure that we're talking about the full picture. But always right to ask your doctor about anything you have questions about.
Dr. Owais Durrani, thanks for letting us always bring the questions to you because, you know, sometimes we're scratching our heads and we just need a doctor here, so thank you.
Thanks for having me.
Still ahead.